So the answer is yes. I like what Dr. Oz said when he did a presentation on this topic. And he said if you have more than 8 mercury fillings, then there should be a little bit more urgency on reducing the number of those fillings, or getting them all removed. Some fillings are pretty simple. It's like a small filling, and removing it normally goes uneventful, and that will be nice. But there are times where the filling is really big. If we want to remove it, then we have other risks that will be involved with it, like needing to do a root canal, needing to do a crown, and sometimes that also leads to other complications that could end up, causing the tooth loss. And I think with those kind of situations, we got to be very cautious as we tap into this topic. So following the recommendation of the Academy of Oral Medicine and Toxicology, we did use an oxygen mask for our patient and the rubber dam to prevent the ingestion of the debris from the filling, and also the dental air vacuum to remove the aerosol that is produced by the drilling, and also like a heavy-duty mask for us as providers, so we're also not inhaling the debris and the vapor that comes out from the drilling process. We did find in our practice, that the most useful piece of equipment is that dental air vacuum. We love it. It just sits very close to the mouth, and it has a powerful suction that removes the air from this area, so our patient is not breathing it, and we are not breathing it as well. The rubber dam and the nasal oxygen mask, we do notice that sometimes we end up not using them just because they do tend not to be practical. But we do love that dental air vacuum. So the way I look at it is, I would recommend my patients to put it on the list, on the to-do list. There are so many factors that would determine how high on the list this is. But let's say the gum is healthy, the teeth are healthy, everything is, and the general health is doing pretty well. And now the only thing we have on the list is, hey, we got some mercury fillings, and we're worried about the toxicity of those. Then I would start tapping into that, and I would also do it slowly. It's not like one of those things you wanna go have your teeth drilled on all at once. Maybe kind of do like one side, and then 6 months or a year later, do another side, and kind of chip at it until we get it all taken care of. With this video, we demonstrate basically all the precautions that would show, a safe amalgam removal. We hope you will benefit from this video, and if you have any questions, please feel free to leave a comment or to contact us. I'll be more than happy to answer it, and have a wonderful day.